Welcome back. You're still tuned in to News and Views with myself, Salailo Makwidiri. The time is 18 minutes past 9 Central African time, and we're going to be looking at a story that's a bit closer to home. There was a very, very damning health ombud report which has sent shockwaves through South Africa's healthcare system, raising very, very serious questions about ethics, about accountability, and the very principle of do not harm that medical practitioners have signed up for. Health Minister Motsoaledi has described the findings as deeply troubling, pointing to what appears to be a fundamental breach of medical ethics. But beyond the outrage, what does this mean for oversight? What does it mean for patient safety and trust in the system? We're now joined by ActionSA MP and also the Health Portfolio Committee member, Mr. Kgosi Letlape. Doc, thank you so much for joining us. Always a pleasure having you on Salam Media. Really, really appreciate you giving us your time. Dr. Letlape, can you hear me? Dr. Letlape, are you there? All right. We seem to be having some problems with Dr. Kgosi Letlape there. But while our technical team is sorting it out, I'm just trying to get the gist of that report and essentially what it found out and what it exposed. The Health Ombudsman report, it is essentially an oversight report by the Health Ombudsman, and has found out that there's been adverse findings when it comes to some of the maladministration that happens in the public health sector. It has made adverse findings in investigations of serious clinical governance breakdown, unsafe conditions in 2 separate deaths. The findings are from an investigation at George Mokari Academic Hospital and Netcare Femina Hospital out in Tshwane regarding illegal admission processes, withheld treatment, and a fatal medication error. Mental health care patient Lerato Mhlami, 35-year-old, died after a fire in the psychiatric unit at George Mokari. This was in June 2024, and I think we all remember that. And there was also a baby that unfortunately lost their life, baby Motsoaledi Decries, who died at the Netcare Femina Hospital. And there were some key findings from that report, which essentially the Health Ombud found out that Mhlami's admission at George Mokari did not meet legal requirements, as she was not independently assessed by 2 medical practitioners, effectively rendering her admission invalid and violating her rights. And it's a whole report that we're going to try and dissect and look into with Dr. Letlape. Dr. Letlape, can you hear me now?
Yes, I can hear you now.
Yes. Dr. Letlape, just your immediate reaction to the Ombud's findings. How serious were some of these breaches in your view, and what kind of picture do they paint about our health sector here in South Africa?
These are serious breaches, the most egregious breaches that you could have in the healthcare system. No one wants to send a loved one to hospital who ends up dead on a preventable death. So this is very egregious. It may involve one person, but it's of the same magnitude as what happened with Life Esidimeni a few years ago. And really, you have 2 failures, a system failure and a failure of the healthcare professionals that were supposed to take care of the patient. And both matters need to be addressed. And I think the most important thing is to thank the Health Ombud, Professor Taule Mokoena, and the team for comprehensive report. And really, now it's time for us to deal with this decisively, to show that all lives matter. And what we would like to see, in addition to what the Professor Mokoena has suggested in terms of the individuals involved, would be to ensure that that facility must be closed down for inpatient services until it's restored to the standard that is acceptable.
And I think that's very, very important to note. You touch on accountability, which is very, very important. From your perspective, who ultimately carries responsibility here? Is it the individual practitioners themselves? Is it hospital management or the Department of Health? Who does the buck stop with when it comes to the responsibility and ultimately consequences of these findings?
Well, there are three levels of responsibility, as you've said, and all of them need to account. But we also, as members of society, need to be asking ourselves a question: what's happened in the last 32 years? What have we witnessed? Because clearly, when you go into the details of the report, there's a point that the professor makes, where he compares the staff complement of George Mokari Academic Hospital. And remember, an academic hospital is a tertiary institution that should be one of our best facilities in the country. When you compare that hospital, which is originally a black hospital, with Steve Biko Academic Hospital not far away, which is originally a white hospital, the staff complement are stark. You have three consultants in the psychiatric unit at Steve Biko Academic and at George Mokari. But the three at Steve Biko are responsible for 20 beds. The three at George Mokari are responsible for 120 beds. That is a disparity. So apartheid still lives 32 years. So we need to be asking, under 32 years of democracy, what have we done? What has the government done? What has the national government done? What has the Gauteng provincial government done? What has the Department of Health at national done? What has the Department of Health at provincial level done? This is totally unacceptable. And there should be accountability at all levels. You can't just come up now and you have a plan. There are going to be doctors that are going to put there when you knew that it was an inadequately resourced organization. The issue of mattresses, procurement, fireproof mattresses in isolation, they do not exist. So it's a whole system error, and at all levels there has to be accountability. But more important, what we need to do is to ensure that the patient professional ratio that is at Steve Biko Academic Hospital should also be implemented at George Mokari Hospital. There's absolutely no reason why under the same government, at national and at provincial level, that we have those disparities within 40 kilometers of each other. This is not a deeply rural hospital. This is a semi-urban hospital. And you know, when you go into the history of how that hospital was started, how that medical school was started, and the lack of support it's been given over 32 years of democracy, the attempts to disrupt it and dismantle it, and it survived. But it is now time that we put the government on notice that that unit must be closed until it is fit for human consumption. It
And
should not be an issue of
touch on
incremental.
something that you sorry doctor to interject, but I want to touch on something which is very, very important, and you briefly touched on the ultimate oversight failure here, because how one question that one person could ask is, how did this situation ultimately get to the point of where we currently find ourselves without any kind of intervention? Were there warning signs that were ignored and ultimately led us to these findings that the health ombuds ultimately revealed?
When you look at our institutions in terms of their infrastructure insufficiency and the challenges in human resources, there are disasters waiting to happen. So none of us can talk about were there warning signs. When you look at the stark reality of the staffing norms at Steve Biko and the staffing realities at George Mokari, that should have been alarm bells. The fact that we now have money that has been apportioned to employ healthcare professionals. Why was it not done 20 years ago? Why do we have to wait for a disaster and for loss of lives to react? Why are we not having normative standards that must be upheld? We've created an Office of Health Standards and Compliance. Any institution that does not meet the standards should be closed down until it meets the standard. When you look at the mental health care services at Steve Biko Academic, juveniles, there are no inpatient facilities, they are transferred to other facilities. What needs to be done with immediate effect is to stop the inpatient side. Even for adults, transfer them to Steve Biko, Sterkfontein, and other hospitals, and have an urgent reform program to make that facility up to standard on all levels, in terms of the infrastructure, in terms of the bedding, in terms of the staffing norms, in terms of the training of the people, in terms of the quality of services that get offered. So that you have a lot of breaches. You got young people that are in training that could not be supervised. Now, there are issues of service loads, and people must not misunderstand. The professionals must be held accountable. It doesn't matter how short-staffed you are. You still treat patients with the utmost respect. And we need to go back to insourcing security so that the institution takes responsibility for the level of training of security officers. I mean,
I want to touch on
shameful.
I want to touch on the minister's response, Minister Motsoaledi. He has expressed shock. In your opinion, is that enough, or should we be seeing more decisive action at this stage?
I think it's time where we take accountability. If the minister says he didn't know that there were 3 consultants for 120 beds at that hospital, and there were 3 consultants for 20 beds just across the Mabopane freeway, then maybe he has a reason to be shocked. The question then arises, how could he not know? How does he not know? Does he not know what the staffing norms are? And that becomes a problem. So we got to stop pretending to be shocked and accept that we are negligent. Accept that we are not the custodians of democracy or equality to everybody. We are not delivering on the promises of Section 27 of the Constitution to all citizens. And this is no time. This is a time for someone to commit that this will never happen again. We've had life as a demand. Thanks to the Ombud of the day, we had the report that we have. Thanks to the Ombud of today, we have this report. This is no longer time to be shocked. This is time to fix the healthcare system. This is time to declare a crisis. There are things that are being declared as national disasters when we have inclement weather and infrastructure is destroyed. We need to declare a national disaster in terms of our infrastructure, particularly the infrastructure that was historically for Black people. It is in a state of disrepair. There's huge issues in terms of lack of resources, lack of support. What you need to ask yourself is, how are we different from an apartheid state? When we've now created a health system that we will not use ourselves. And I'm not speaking about the minister personally, because he goes personally to public service, but let's talk about the big picture. Where do we go as parliamentarians? Where does the Premier of Gauteng and his members of the legislature go for their healthcare? Where do the people that run the head office of the Gauteng Department of Health go for their healthcare? Where do the very staff that work in our institutions go to their healthcare? And that is fundamental to the crisis that we see.
Very important.
You have people that were involved in this. Some have resigned. They're already working in the private sector. Now, there are people that have not resigned who work in the private sector and are employees of the public sector. Their attitudes to patients, the same person acts differently in the public institutions to the way they act in the private institutions. So we do not value lives the same. So part of our biggest problem as a nation is a values crisis, because the same professionals, it's not that they are not well trained, they just treat citizens differently depending on where they see them. And that's fundamental to the values crisis in our society.
I want to come to the parliamentary role here. Are we probably going to see, any specific measures that are going to be taken by the Health Portfolio Committee, which you are a part of, in ensuring that there is ultimately accountability for this gross misconduct?
Well, I'm tired of the responses of there's something happens, we organize an oversight visit, and we come, we make recommendations, and a year later, nothing has happened. The time for Trapsukis is over. So I'm going to act as an individual member of parliament, supported by my party, to make sure that public healthcare services are fit for human consumption and that I would use them for myself. And that's what we do. And we need to ensure that this public healthcare system is properly resourced. And nobody must come here and tell me about the hoax called NHI. That's a hoax. We can't be waiting for 7 more years to fix
proposing. That seems to be the answer that government is proposing. NHI
that is not the answer.
Supposedly the answer.
That is the promissory note. We need solutions now, not in 7 years' time. We need to a determination and a budget to fix the public healthcare system. We need someone that would do an analysis. When they come and they say they now have money to build a new hospital for George Mukhari Hospital, they must find money within the next 90 days from Treasury to restore what we have right now so that it is fit for human consumption. We know the overruns of new hospitals, over budget, never delivered in time. People need to have their facilities rehabilitated now. So the fact that there's a new hospital that comes in that should have been built 30 years ago should not detract from the fact that we need refurbishment, and we need it now, and we need it urgently. And until the refurbishment occurs, we need to divert. We need to ensure that the resources are mobilized. Instead of coming up with this thing that divides South Africans, we need a solution that unites South Africans. NHI in its current form is divisive and will never deliver on its promises. And there are simple ways to fix this public healthcare system. If it were up to me, I would go to Parliament and say, we need extra resources for a public healthcare system. Let's come up with a legal framework to introduce a dedicated health tax paid by all South Africans that earn, all citizens that earn, and that fund's sole purpose would be to ensure that we refurbish and rebuild the public healthcare system, and that all of us as citizens can access the public healthcare system free of charge. That way, you unite South Africans, and it's a simple solution. You do not disband the medical aids. You then ensure that you implement the health market inquiry recommendations, so that those that choose to be on medical aid can choose to be that, but they need to get value for money. We have a duty to ensure that they get value for money because they are pulled through an act of parliament. So we do the two things together. And there should be no threat of saying at some point, medical aids will disappear. How do you create the biggest fund that this country is going to see to be under the custodianship of people that can't even keep our mental health care patients safe in an institution. Why would you give them such a great responsibility when they are not fit for the responsibility that they have right now?
Very concerning state of affairs. I'm going to be there for now. Always a pleasure, Doc. I really appreciate you giving us your time. And if there are any other developments, I'm sure you will be chatting in the not so distant future, you and I.
Thank you. And I think just as a last word,
yes,
all of us as citizens must rise. This happens because we as citizens allow it to happen. We as citizens are committed to ourselves as individuals, and we want a better dispensation for ourselves. We even leave our relatives somewhere else, and we want to escape. It's time South Africans thought about a new South Africa that works for all of us.
There you have it. ActionSA Member of Parliament and Health Portfolio Committee member, Dr. Kgosi Letlape, giving us his immediate reaction to the Health Ombuds findings. A very, very damning report about the state of some of our hospitals, public hospitals. And paints a really, really ugly picture and story that will continue following quite closely, especially the consequences aspect of it. Who should be held accountable, and will they be held accountable? Going to take a quick break. News and Views continues after this.